All right, and we are live. This is the voice and the face of Dr. Olabintan, CEO, founder of Livingspring Family Medical Center here in the great city of Mansfield, Texas. We're here with another live, yes, so soon, discussing fibroids. Yay. And I'm so
Yay.
excited to be here with the one and only fiber doc, Dr. Cheruba Prabakar. Thank you so much for coming. Did
Yeah.
I butcher your last name?
Prabakar. Cheruba Prabakar.
Prabakar.
Yes. Thank you.
Forgive me for doing that. But while we have you here, I want to say a big thank you for coming. I know you're very busy, and I appreciate you taking the time to come and be a blessing and teach my viewers. So, yay! Thank you, thank
Yeah.
you.
Thank you so much for having me,
All
Dr.
right,
Cheruba.
awesome, awesome, awesome. So that being said, can you kindly reintroduce yourself, who you are, and what you do?
Yes. So I am Dr. Cheruba Prabakar. I'm a board certified OBGYN and a fellowship trained minimally invasive surgeon. I'm from the East Coast, actually trained there, and but currently live out here in the West Coast and practice in Oakland, California. And my specialty or niche, I should say, within my specialty is really caring for women with fibroids and helping them live a life with reduced bleeding, pain, and improved fertility.
Awesome. Hence the name Fiber Doc.
Yes.
But
Yes.
but I gotta say, I love what you do because it improves the quality of life of women. So I'm very very thankful that you do what you do. So no, that being said, why did you hone in on fibroids? I think you alluded to it when you introduced yourself, but is there a story like why? How did you become an OB/GYN, and why did you choose the field?
Yeah.
Curious mind. No.
Yeah, that's a good question. So OBGYN I chose because it's so diverse. One day you're in the office, then you're delivering a baby, and then you're in the operating room, and
Mhm.
really just taking care of women. So I just love that aspect of it. I went to a women's school for college in the East Coast, and so yeah, I just was really drawn to that, and then decided to subspecialize in surgery
Okay.
because there were so many new techniques that were coming up, the robot, laparoscopy. There's a lot to master. So I decided to do the fellowship, and where I did my fellowship was in Brooklyn, New York, and
Okay.
a lot of our patients that we had were patients with fibroids. And so I think I early on, just during my fellowship, I just really was drawn to that because that was the majority of my patient
Mm.
population. In residency, I remember patients with fibroids having a terrible time with pregnancy. They got pregnant and they had so much pain and preterm contractions. So it always sort of just stood out to me and
Mm.
kind of had a special place in my heart, if you will. And then when I moved to Oakland, California, all the way across the country, interestingly, the patient population was very diverse and very similar to that of Brooklyn. So I continued to have a lot of patients with fibroids. And so I just ended up doing a lot of these surgeries and got good at them and just really started liking them and then developed that as my niche within my specialty.
Specialty. It looks like the signs have been pointing to you doing this. So you're
Yeah.
walking. All the signs are pointing to you doing this. So this is good. So for those who are wondering, what are fibroids? In simple terms, what are fibroids, doc?
Yeah. So fibroids are smooth muscle tumors of the uterus, and that's all they are. They can vary in size. Sometimes they're 1 centimeter, sometimes they're 10, and they can vary in their location within the uterus. But essentially, they are smooth muscle tumors. The uterus is made up of smooth muscle, and so it's like a little ball of smooth muscle. And most often, 99.999%, they are benign or non-cancerous.
Okay. All right. So extra balls of tissue, and usually an emphasis on most likely not cancerous. Okay, because the word tumor can sound a little scary.
Exactly. Yes, they're benign or not cancerous. Mhm.
All right. So the next question is, someone's asking, can I get pregnant even with one? Does it reduce my chances of getting pregnant, having a fibroid or having fibroid?
Yeah, so that really depends on where the fibroid is and how big it is. So when we talk about fibroids, They can be located in different places within the uterine cavity. They can either be inside the cavity, like where a baby forms, where you
Mhm.
get your period from, like inside the cavity, or they can be in the wall of the uterus, or they can kind of be rising from the surface on the outside of the uterus. So it really depends on where it's located. So um, you would definitely want to get a scan and see where they are and how big they are. So if it's a small 2 centimeter fibroid in the wall of your uterus, you're not going to really, that's not going to really affect you. But if you have 3 fibroids inside your cavity, or if you got a huge, 15 centimeter fibroid, well, that could definitely affect your chances of getting pregnant and then staying
Mhm.
pregnant, because fibroids can also increase your risk of miscarriage if they're inside the cavity. So I think those are the two things to really think about. Where are they and how big are they?
Where are they and how big are they would
Yes,
decide or would be instrumental in deciding the risk as far as
exactly.
pregnancy.
Exactly. But I have a lot of patients who are successfully able to get pregnant and carry pregnancies, even with fibroids. We just have to treat them, beforehand.
Okay, awesome, awesome. And I have a very good question. Hi, Trailer. Thank you, Tanisha. Thank you for joining. She says, "Why do they cause an increased amount of bleeding during a woman's menstrual cycle?"
Yeah, that's one of the things that a lot of patients suffer from, which is heavy bleeding clots. So, given the location of where the fibroids are, if they're inside the cavity, and that's the tissue that's being sloughed off during your period, and so they interfere with that tissue and the blood supply to that tissue, and so this is why they cause heavy bleeding and clots. Similarly, if they're very big and they're on the wall of the uterus, they're still pushing into the cavity. And so when you have heavy, heavy bleeding and clots, that's sort of a clue that those fibroids are actually inside, they can be inside the uterine cavity.
Okay. Does that help? Thanks for asking. That's a very good question, by the way. The next question is this: is there something to do to prevent them? Because they seem to be, I don't know if you agree with this, but prevalence in African American population. So it's like, is there something to do to prevent this from happening? What would you say to that, Doc?
That's like the holy grail, the $1 million question, however you want to phrase it, because you're right. 90% of African American women and South Asian women, even women of color, are disproportionately affected by fibroids. There are a lot of studies that have tried to tease out, like, why is that? There were some hypotheses that it could be like hair straighteners that women, African American women, were also using. There's definitely a theory about estrogen dominance. But there's no like clear answer that says, oh, okay, like this, if you stop doing these things or if you start doing these things, you're
Mm,
gonna, help prevent fibroids. The We do have a couple of big studies that have come out that have shown that really doing a plant-based diet and increasing the amount of cruciferous vegetables such as broccoli and cauliflower can really help prevent the formation or can shrink or prevent regrowth of fibroids. So that is one thing that we have in control of, things that we can do. So definitely anti-inflammatory kind of more plant-based diet is something I recommend to all my patients. And then genetics, that this is like there's so much research being done on it, and I hope that in the next decade we find out, if there's like some medication that can
great.
block a gene, but you'll often hear patients say, oh yeah, my mom and my grandmother and everybody had fibroids. So that is a risk factor as well.
Awesome, awesome. And of course I have bias to this, but I love the plant-based diet aspect. It's amazing how much your diet can affect your health. And the recurring theme I see with a lot of the lives that we do, and speaking with other specialists, is the importance of eating well. And so plant-based diets can help. Now, of course, I'm not saying that that's going to treat it per se, but it could potentially shrink it, like you have said.
Yes.
All right, and very good, Miss Trailer. She's asking another question, and it's actually going to be similar to the question I was going to ask. A lot of times, the big scare is, "Oh, I have fibroids. I must need surgery." She's saying, "I have fibroids, and several options were suggested, such as surgery and medicinal approaches. such as progesterone and other medications to take during the menstrual period to reduce the amount of bleeding. Is one better than the other? And what are your thoughts on embolization? So she's asking two questions. So let's talk more about the non-surgical options for patients. Now, of course, these are medical suggestions. It's very, very important for you to see your doctor. If you need to reach out to a fibroid doctor here, we'll give you that information at the end as well, so you can find out where she is and schedule an appointment. But it's important for you to have a personalized care because everyone is different.
Yes.
But the first question I wanted us to address is, how can it be treated non-surgically? Generally speaking, yes.
Yeah. So, the treatment for fibroids really depends on what your symptoms are. So if you're having a lot of bleeding and clots, then this is something that can be treated medically via hormonal management. So we've got, a host of medications that can be used for this: birth control pills, progesterone only pills, the Mirena or the Skyla IUD can help. The Nexplanon, or the little rod that goes in your arm, that can help. And then there is a new medication also called Orion that helps reduce bleeding associated with fibroids by blocking the estrogen and progesterone receptors in your body. So there are a lot of, several classes of these medical therapies that can help women treat fibroids without, surgery. Now, if you have a 20 centimeter fibroid that is causing a bulge in your stomach and your abdomen, and you feel like it's poking out, well, these medical treatments are not going to really help with something like that. The medical treatments are more really just to control the bleeding and help with that symptom. So if you have a huge mass and you can't button up your pants and you're looking pregnant and things like that, then that's when you want to consider surgery, or the uterine artery embolization is a great option for that.
Okay, very good. Thank you so much for answering that question. And I have another question. Hi there, Delapo. Thank you for asking the questions. And they're asking, why do fibroids reoccur after an initial myomectomy? So you've gone for the surgery, you wanted to preserve your uterus, so they took out part of the fibroids, but it came back. Is there something like why, Doc?
Yeah, it's very frustrating. I just had a patient with the same thing. 30% of fibroids will regrow. We don't know why, unfortunately. And I think this is where it's the interplay between genetics and lifestyle. So I don't have a great answer. I wish I did. But this is why I tell patients who are seeking fertility, if they're really going to go ahead and operate and, remove fibroids, to do it as close to, when they want to get pregnant as possible, so that, they have the surgery, they have that little break for the uterus to heal, and boom, then they're trying to get pregnant, or they're doing IVF or IUI or whatever it is, and not just, let years go by because you have that 30% chance of regrowth.
Okay. That's a very good point. I like, you emphasize, I think that addresses the next question he was asking. If you're planning to get pregnant, or you even need to go for any kind of artificial type fertilization procedures, you want to do the surgery as close to planning for pregnancy, so that the chances of it coming back is slimmer.
Exactly.
Time. Okay. Yes. Good. This is good. I hope people are benefiting, and people are commenting. I don't know if you can see that, and they're appreciating your feedback. So thank you, Doc. And next question is, do I have to get rid of them if it doesn't bother me? So we have a patient who is having, for whatever reason, has some imaging done, and they find a fibroid. Do you have to do something about it if it's not bothering you? What do you think?
Absolutely not. You do not have to do anything about it. So this is a common thing that I see in my practice. I'll get referred from a primary care doctor because they were doing a scan for something else. They were doing a CAT scan for abdominal pain, and they saw a 1 centimeter fibroid, and the patient's all worried, and they come running to me, and they're like, "Oh no, I have a fibroid." So that if it's small, you never even knew you had a fibroid, it doesn't really bother you. It doesn't cause bleeding, pain, infertility. It's not huge, poking out of your abdomen. Nope, you would just leave it alone. And sometimes they'll just stay the same size. Sometimes they can grow in the reproductive years and then kind of shrink back during menopause. For those patients, I just would recommend, maybe just getting a scan every 2, 3 years just to kind of keep an eye on it. But no, you absolutely don't need to. If it doesn't bother you, don't do anything about it.
All right, doesn't bother you. Don't worry about it.
Yeah, don't fix it if it ain't broken.
I concur. I concur. You actually answered the next question I was going to ask about those who are going through menopause. So for those who are like late 40s, almost 50s, like I have a fibroid, my periods are still heavy. Why? Like, do I need to do anything about it? Should I go do surgery? But you're saying it could shrink over time, and sometimes we just duke it out. I know
Yes. Yes, sometimes, it really can shrink, or it won't necessarily go away, but at least it won't be growing and causing you symptoms. The tricky part with perimenopausal and menopausal women is we don't know when you're going to hit menopause. The average age is 52 in the US, but some people are hit menopause right at 52, and there are others who are still getting their period at 56, 57. So it really depends on how it's affecting your quality of life. If it's a little annoying, but you can kind of deal with it, some patients will say, I'll just wait. But, if you're soaking through your pads and your pants and you can't go on vacation and your whole life is revolving around your periods, then that's when I see patients say, well, forget it. I'm going to do something about it now. So I think those are the things to think about, because that term menopause, that doesn't always happen at 52.
Yes, that is true. And what you said just actually, I think, answered the question. Miss Trailer was saying, and you had answered it earlier. She says it's just bothersome because her cycles are so heavy, it keeps her trapped at home. So quality of life is affected. And she says, I pray for menopause soon.
Yes, I so many patients say the same thing to me, but I really encourage women to think about the quality of life. Because I have seen quite a few women, menstruate till 56 or 57.
I had
And
one at 65. The word 60, she was
my.
63. Yeah, I felt so.
Yeah. So that can happen. So if you're still getting periods every month, chances are you're not really close to menopause. And so I would think really hard. And this is the kind of paradigm shift I encourage women to think about, because I think in previous generations, it's like, oh, just like, don't worry about it. This is normal part of, getting old, normal part of having periods, or just like deal with it till you hit menopause, right? There were so many women say that to me, just deal with it. Like, but then when they're telling me the stories about what's going on in their life, I'm like, really? You want to deal with that for the next potentially 10 years, 12 years? We don't know. So I think that's where it really comes into play. Like, what is your quality of life? And, are you willing to put up with that versus, do surgery? And surgery has its own risks, of course. So you have to weigh that out. The time, when it comes close to menopause, the time when I really encourage surgery is for patients whose fibroids are still kind of rapidly growing, because that makes me pause and think, is there something abnormal going on here? Are there cancerous cells, starting up? And so, if your fibroid was 4 centimeters and now suddenly it's 8, and you're 52, that would make me a little more worried. And that's when I tell patients, like, okay, I think, we really need to get this out.
Okay. This has been so useful. I've learned a lot of things I would use to empower my patient, encourage them to go see their gynecologist and have these discussions that, you have patients who it affects the ability to exercise because they're afraid that they're going to bleed through. And so they stay
Right.
home, and sometimes they eat to feel better, or just different things. So quality
Yes.
of life is important just as much as your quantity of life. And so having
Yes.
these discussions are important.
Yes. No, I agree. And I think we should be encouraging women to think more on those terms, because I think historically we haven't been empowered to do that, So in my practice, that's what I tell patients. And I'm so happy to provide these options when patients say, well, I went to Dr. A and Dr. B, and they said, just wait it out. And, it's all normal part of aging and this and that, which is not true. If you really have a fibroid and it's causing you issues, then you should just take care of it.
Awesome. So a lot of thank yous in the comment here. Dr. Prabhakar, thank you so much for coming. Now,
Yeah.
people are wondering, I like this doc. I want her to come talk at my function. I want her to come enlighten my audience. Where can people find you, doc?
Yeah, thank you. I can't actually see the comments, but thank you everybody for your kind words. You can follow me on Instagram at the Fibroid Doc, THEFIBROIDDOC. And then my website is www.thefibroiddoc.com. I have a Facebook page as well, Cheruba Prabakar MD. So my website has my email. I would love to come and, be a speaker, or if you have any other questions, just send me a message and I'll make a YouTube video. My YouTube channel is also the Fibroid Doc, and I put out little videos every week. So if you have certain questions that you want answered, just send me a message and I'd be happy to make a little video of that. Yeah, and follow me on Instagram.
Awesome, awesome, awesome. So I'm going to have you, Mr. Adid Dolapo, to do that. He has a question. Okay, I'll ask. He said, can you please talk a bit about quality of life? I guess more so. Oh, she's asking. I'm sorry. Please, talk a little bit about quality of life, in regards to, you know, we ignoring that, and you alluded to that earlier. A lot of times, there's some things we normalize and say, that's just part of me. I have
Yeah.
to bleed a lot. I have to be in pain. That's just something I have to deal with. So she's asking, what could you explain that a little bit more?
Yeah, that's a really good question, and I think a very important one. So, your periods, normal cycles are anywhere between, for some people, as fast as 24 days to 30 days, 30, 31, 32 days. So, by now, you've figured out, what your particular cadence is. And as we get older, closer to menopause, your periods can start to come a little faster. So, every 3 weeks, then every 2 weeks, and then they space out. But for a normal period, it should really be, 27 to 32 days or so. And you should be, everyone's different. Some people have a little more heavy periods, so they're using, 5 tampons a day or 5 pads a day. Others are pretty light, or most typically people will have the first 2 days are really heavy, and then it
Mm,
starts to peter out and it lasts maybe 5 days, 6 days. So that's what a normal cycle looks like. Now, when patients come with fibroids or heavy bleeding, they're often saying, my periods are lasting 10 days. I have to wear a diaper, along with my tampon at night. Otherwise, I'm soaking the sheets. Or I'm feeling lightheaded and dizzy because I'm bleeding so much. I had to rush to
mm,
the ER to get a blood transfusion. Or the other side of the story is they say, I never know when I'm going to bleed. And so it's very hard for me to plan a vacation with my family. It's hard to
mm,
really I wear any light colored clothing because I never know when I'm going to bleed. And so it's the
mm,
unpredictability of it. And so only you can answer that question as to how that's affecting you. So if you have kids and you're running around after them and to all these school events, or if you're a business person who's traveling all over the world, well, this can be kind of a serious problem for you. If you're somebody who works from home and you have the luxury of, kind of, it doesn't really matter what you look like or how many times you're running to the bathroom, or you don't have
mm,
to feel awkward about, leaving meetings and stuff, well, then it may not be such a huge deal for you. So I think I encourage women to really dig deep and think about how this is truly affecting them, and imagine your life if you didn't have this problem,
mm,
right? So if you can imagine your life without these periods, or without
mm.
these heavy periods, where you can look at a calendar and say, yep, I'm going on vacation this weekend, and I'm wearing shorts and I'm wearing white pants and I'm going to have a good time, right? So that's what, white pants are crucial for every vacation, by the way. So I think just thinking about that and really being honest with yourself, and then speaking to your doctor about, maybe you're too scared to do surgery, but maybe there are other options like embolization and medications. Or you're like, I'm done with this, I just want to live my life, I don't want to worry about another period, just give me the hysterectomy. And that's fine. Nobody should be judging you for that. So I would just really think through these things before you go to your gynecologist,
Mm.
because they're going to present you with all these options. And
Right,
then at
right.
least you've thought about it and you've said, okay, well, yeah, I'm going to go for that because I'm done. Or I'm going to try this one other thing. So
Before, right,
yeah,
right.
just encourage you to really have a discussion with yourself about that.
Awesome. Awesome. Well said. I hope that answers your question, Mr. Adidolakwa. I just remembered you. Thank you so much for joining. But that being said, thank you so much, Fiber Doc, for being here. You were awesome. What I'm going to do is definitely share that information at the end of this live so people have access to you.
Yes.
But thank you so much.
Yes,
You've
this was
been
so
very,
much fun. Thank you so
very
much
helpful.
for having me.
You are welcome. And we'll do a part 2. I'm sure people have more questions. We'll go from there because fibroids is a big deal.
Yeah, that would be great. And yeah, sign up on my email list for my website, because I'll be having webinars, on a regular cadence where we dive deep into certain aspects of fibroid care. So yeah.
I follow her page. You should. She's good. She knows what she's talking about. So this is good. Thank you all so much for joining. Thank you again for coming. For those who are watching this live, #live. I always ask at the end because I forget sometimes. And replay, #replay. And please, by all means, share this with those who would find this useful. That being said, if you or anyone you know is looking for an awesome, a passionate, and a thorough family physician in the Mansfield, Texas area, I am she. Thank you so much. Thank you, Dr. Cheruba.
Awesome.
Thank you.
Thank you. Yes. Bye-bye.